Overactive bladder is the presence of frequency, urgency, and urge incontinence. Not all patients have to have incontinence to be classified as having overactive bladder. Overactive bladder is very common. In fact, there are at least 30 to 40 million Americans that suffer with it at any one time. Oftentimes, we don't know what causes overactive bladder. The most common tests to diagnose overactive bladder actually are simply talking to the patient and understanding what their symptoms are. Now, there are some tests that may lead to a diagnosis such as urodynamics or cystoscopy. While overactive bladder in most cases can't be prevented, there are certainly some bladder healthy preventative tools that can be utilized, such as good voiding habits, an appropriate diet. These are all things that can be incorporated into a patient's lifestyle. While many people can deal with overactive bladder, there are benefits associated with seeing a physician who specializes in overactive bladder. These physicians typically have access to very modern medications and procedures that can assist you at a higher level with perhaps more level of success. Our typical pathway for taking care of patients with overactive bladder typically involves, at least at first, a history and a physical exam. After that point, we typically recommend medical therapy, usually a trial of at least 2 medications. Depending on the results, we may recommend further evaluation with either urodynamic study and/or cystoscopic evaluation of the bladder. And then finally, if these therapies identify proper candidates to proceed, then the next step in our care pathway typically includes neuromodulation. Spending time with the patient and understanding their needs, their wants, their desires for their bladder, for their lifestyle, is the most important thing in understanding which treatment option would fit that patient the best. When we look at satisfaction rates for the different therapies that we offer, medical therapy in the short run yields good results. But oftentimes we find that patients stop taking these medications and therefore their symptoms return. When we look at advanced modalities, because these are more permanent, they tend to fare better. When we look at our own patient population, we see that approximately 80 to 90% of our patients who have neuromodulation have successful outcomes. When we look at injection therapy, those patients have success as well, but those patients do have to continue to have injection therapies approximately every 6 months. And so they tend to have somewhat of a slightly lesser successful outcome in the long run. There are long-term consequences to having overactive bladder, which is why we feel that it's very important to treat it. These are wide and far varied. They can range from depression, they can range to persistent incontinence that leads to infections, long-term use of diapers and undergarments that ultimately lead to complications. In fact, the number one reason why people get admitted to nursing homes is incontinence. And so these are all long-term issues that we must treat. And the sooner that we have the ability to treat these patients, the better the outcome.